The following segment is sponsored by University of Utah Health. Are you struggling with pain, pinching, or loss of mobility in your hands? Dr. Robert Teixeira is here to tell us all about hand and thumb arthritis. Welcome to the show.
Thank you.
Thank you for being here. We appreciate you. Okay, what types of hand arthritis is there?
So, hand arthritis, swelling and pain, inflammation of the joints. There's osteoarthritis, which is probably the most common. It's just general wear and tear. There's rheumatoid arthritis, there's gout. Some people can have infections that lead to arthritis down the road or bad traumas, but most common, osteoarthritis by far.
Okay, a lot of different types. What is arthritis? We talk about the definition.
So we're talking about mostly osteoarthritis, which is normal wear and tear. All your joints, they have bones, and then they have cartilage on the ends, and that cartilage provides a nice, smooth, gliding surface.
Yeah.
Over time, as you use your joints to live your life, that cartilage will wear down. You start getting pain, swelling, inflammation.
Starts to hurt a little bit. Okay, what conditions are associated with hand arthritis?
So there's other things associated with it, like carpal tunnel syndrome, cubital tunnel syndrome, and trigger finger gout can be associated with it. Bad fractures involving joints can be associated with it too.
Okay, and how does one get this? Is it just over time, like you said, overusage?
It's just normal life.
Being a human, doing everything we do.
Tear. If you work in jobs in which you're using a lot of manual labor, heavy work, that's another way you can get it.
Kind of repetitive things with your
motion
arms.
over a long period of time.
Okay, now what treatments are available? Maybe let's start with non-surgical.
So, non-surgically, we can do things like Tylenol, ibuprofen, resting it, icing it, wearing a splint. Sometimes you can see hand therapy that can teach you ways that you can use your hand in a way that doesn't aggravate arthritis or put too much stress on your joints.
Yeah.
And the final thing, steroid shots.
Okay.
They can provide generally temporizing relief for about a couple of months, and there's nothing wrong with doing them over a long period of time.
Sure. Okay, now what about surgical treatment options?
So it depends on where exactly the arthritis is on the hand. The most common arthritis is at the thumb base right here.
Right here, okay.
Because that's got the most amount of motion in your hand.
Right.
And the best surgery for that oftentimes is we remove a little bone there and we resuspend the thumb to the rest of your hand in a way that you'll be able to move your thumb pain-free.
Yeah, have that relief. Okay, when is it time to call the doctor, and what symptoms would we be having?
So generally we'd be having a lot of pain, swelling at that joint. And when you're thinking about seeing a hand surgeon for it, you should have really exhausted and tried doing everything else non-surgical. So that's Tylenol, ibuprofen aren't helping. You're waking up, you're not able to open jars easily.
Sure.
Pain's affecting your quality of life significantly.
Okay, that's good to know. Doctor, thank you so much. We really appreciate you for being here. And for more information, you can visit the website at the bottom of the screen. Dr. Teixeira, thank you. Great to see you.
Thank you very much.